All right, welcome to The Explainer. Today, we are tackling a medical emergency where every single second is absolutely vital: a stroke. We're going to show you how to spot it and exactly what to do when you see the signs. Let's just jump right in with a number that's, well, it's pretty staggering. 2 million. That's roughly how many brain cells die for every single minute a stroke goes untreated. That's speed, that incredible rate of damage. That's exactly why they call it a brain attack. So, what is actually happening during this brain attack? Well, a stroke is a really serious, life-threatening condition where the blood supply to part of the brain just stops. And without that oxygen-rich blood, the brain cells start to die off. And that can affect everything from your memory to your ability to move your muscles.
Okay, so this whole brain attack thing, it really boils down to two main culprits. It's either a blockage or it's a bleed. And understanding the difference is pretty critical.
Honestly, the easiest way to picture this is to think about a plumbing problem. You've got your blocked pipe and you've got your burst pipe. The blocked pipe is called an ischemic stroke, and that's the vast majority of them. We're talking 85%. That's where a clot just plugs up an artery. The other kind, the burst pipe, that's a hemorrhagic stroke. That's where a blood vessel actually ruptures and bleeds into the brain. Now, you've probably heard people talk about a mini stroke, right? Its official name is a TIA, which stands for transient ischemic attack. And let me tell you, even if the symptoms seem to disappear, it is not something to just brush off. With the TIA, what's happening is that blockage is only temporary. So the stroke-like symptoms show up, but then they go away, usually within about 24 hours. But here's the thing you have to remember. You can't be fooled by that. Think of it as the ultimate warning shot from your body. It's a massive red flag that a major stroke could be right around the corner, and it needs immediate medical attention. So, the million-dollar question is, how can you spot a stroke when it's happening? Well, thankfully, there's a super simple, incredibly powerful way to remember the key signs. It's called the FAST test. Let's break it down right now. S is for face. Ask the person to give you a big smile. You're looking to see if one side of their face droops. A is for arms. Ask them to raise both of their arms up. Does one arm start to drift down on its own? S is for speech. Ask them to say a simple sentence, like, "The sky is blue." Is their speech slurred? Does it sound strange? And the most important one, T is for time. If you spot any one of these signs, it's time to call for emergency help immediately. And that T, for time, it is absolutely non-negotiable. Why? Because of something doctors call the golden hour. Getting treatment, especially clot-busting drugs, within that first hour, and definitely within 3 hours, can make a world of difference. It can dramatically reduce or even reverse the damage to the brain. Just remember, every minute you wait, more brain cells are lost forever.
Okay, so we know what to do in the moment, but let's rewind a bit. Who is most at risk here? Because while a stroke can happen to absolutely anyone, some things definitely increase the odds.
And if you look at this list, a lot of it probably isn't a huge surprise, right? We're talking high blood pressure, smoking, high cholesterol, diabetes. These are all major players. But here's the good news. Many of these are things you can actually control, things you can actively manage with your doctor and through your own lifestyle choices. And that actually leads us to the most empowering part of this whole conversation: prevention. You can take real active steps to lower your risk in a big way.
So, what's the game plan? How do you build that defense? Well, it all comes back to those core lifestyle choices we all know are so important. Things like eating a healthy diet, getting regular exercise, and of course, not smoking. It's really all about making that shift to being proactive, not reactive when it comes to your brain's health.
But look, if you take away just one single thing from this prevention section, make it this. According to just about every health expert, controlling your high blood pressure is the single most important, most effective thing you can do to prevent a stroke. And because it's often a silent condition, you have to get it checked regularly. It's so, so important. So let's wrap this all up. Look, prevention is obviously your best defense, right? That's your long-term strategy. But knowing how to recognize the signs and act FAST, that's the action that saves a life right then and there. It could be a loved one, a complete stranger, or maybe even yourself. So we'll leave you with this thought. You now have the tool. You know what FAST stands for: face, arms, speech, and time. Just knowing those 4 letters and what they mean, and then acting on them without hesitation, it literally turns you into a first responder, a potential lifesaver.
And that's knowledge that can and absolutely does save lives.